Dementia is one of the fastest-growing health challenges in the world. Today, an estimated 55 million people worldwide are living with some form of dementia. A new case is diagnosed every few seconds. It is now among the leading causes of disability and death in older adults globally. When most people think about dementia, they immediately think of Alzheimer's disease. And while Alzheimer's is the most common type, it's not the only one. Cognitive decline is complex. Age, genetics, vascular health, inflammation, and lifestyle all play roles. But there's another factor that doesn't get talked about enough: medications. This does not mean medications are bad. Many of them save lives. Many improve quality of life dramatically. However, certain drugs, particularly when used long-term or in combination, have been associated in research with increased cognitive side effects in older adults. If you're over 60 or caring for someone who is, understanding these risks can help you have better conversations with your healthcare provider. Important: never stop a prescribed medication without speaking to your doctor. The goal is informed discussion, not fear. Let's walk through several categories of medications that researchers have studied for possible links to memory problems or dementia risk. Number 9. First-generation antihistamines. Older antihistamines, such as diphenhydramine, commonly sold under brand names like Benadryl, are often used for allergies, colds, or sleep. These medications belong to a group called anticholinergics. They block acetylcholine, a neurotransmitter that plays a key role in memory and learning. In younger adults, this may cause temporary drowsiness or mild brain fog. In older adults, the effects can be stronger. A large study published in JAMA Internal Medicine found that higher cumulative use of strong anticholinergic drugs was associated with increased dementia risk. The risk appeared to rise with long-term daily use over several years. Short-term occasional use is different from chronic use, but it's worth reviewing with a physician, especially if memory concerns arise. Number 8. Benzodiazepines. Medications like diazepam Valium, lorazepam Ativan, and alprazolam Xanax are prescribed for anxiety, insomnia, and muscle spasms. They work by enhancing the effect of GABA, a neurotransmitter that slows brain activity and produces a calming effect. While effective in the short term, long-term benzodiazepine use has been linked in some studies to increase the risk of cognitive decline. Research published in the British Medical Journal observed an association between prolonged use and higher rates of dementia diagnosis. It's important to note that association does not prove causation. Some experts argue that early anxiety symptoms could themselves be early signs of dementia. However, many guidelines recommend limiting long-term benzodiazepine use in older adults because of risks such as confusion, falls, and slowed thinking. Number 7. Proton pump inhibitors. Drugs such as omeprazole Prilosec, pantoprazole Protonix, and esomeprazole Nexium reduce stomach acid and are widely used for reflux and heartburn. Some observational studies have reported a possible link between long-term PPI use and dementia risk. One theory is that reduced stomach acid may impair absorption of vitamin B12 and magnesium, both important for neurological function. However, research findings have been mixed, and more recent studies suggest the association may not be as strong as initially feared. The key takeaway: if you've been taking a PPI for years, ask your doctor whether continued daily use is necessary or if a lower dose or intermittent approach is appropriate. Number 6. Antipsychotics in older adults. Medications such as risperidone, olanzapine, and quetiapine are sometimes used in elderly patients for behavioral symptoms, severe anxiety, or psychiatric conditions. These drugs alter dopamine and serotonin activity in the brain. In older adults with dementia, antipsychotics carry a well-documented increased risk of stroke and death. Because of this, the U.S. Food and Drug Administration has issued a boxed warning regarding their use in dementia-related psychosis. They may be appropriate in specific cases, but they require careful monitoring and regular reassessment. Number 5. Z drugs for sleep. Sleep medications such as zolpidem Ambien, esipiclone Lunesta, and Zalplon Sonata are commonly prescribed for insomnia. Though different from benzodiazepines, they act on similar brain pathways. Studies have linked these drugs to increased risk of falls, confusion, and next-day cognitive impairment in older adults. Some research has also suggested a potential association with dementia risk, though causality remains debated. Improving sleep hygiene, cognitive behavioral therapy for insomnia (CBTI), and non-drug approaches are increasingly recommended as first-line strategies for chronic insomnia. Number 4. Tricyclic antidepressants. Older antidepressants such as amitriptyline and doxepin have strong anticholinergic properties. As mentioned earlier, anticholinergic burden, especially cumulative exposure from multiple medications, has been associated with increased dementia risk in several large studies. Newer antidepressants often have fewer anticholinergic effects and may be safer for older adults, depending on individual circumstances. If someone experiences worsening confusion after starting a medication in this class, it should be discussed promptly with a physician. Number 3. Bladder anticholinergics. Medications used for overactive bladder, such as oxybutynin and tolterodine, also block acetylcholine. Research from institutions including the University of California, San Francisco has suggested that long-term use of strong anticholinergic bladder medications may be associated with changes in brain structure and cognitive performance in older adults. Not all bladder medications carry the same level of risk, and newer alternatives may have fewer cognitive side effects. Number 2. Statins. Cholesterol-lowering medications such as atorvastatin Lipitor, simvastatin Zocor, and rosuvastatin Crestor are among the most widely prescribed drugs in the world. There have been reports of memory complaints in some statin users. However, large-scale reviews and randomized, controlled trials have generally not found strong evidence that statins increase dementia risk. In fact, some research suggests they may protect against vascular dementia by reducing stroke risk. If cognitive symptoms appear after starting a statin, physicians may consider dose adjustments or alternative options. But for many people, the cardiovascular benefits outweigh potential risks. Number 1. Cumulative anticholinergic burden. Perhaps the most important concept is not one single drug, but total exposure. Many over-the-counter cold medicines, sleep aids, motion sickness pills, and prescription medications contain anticholinergic properties. When combined, the cumulative effect can significantly increase the anticholinergic burden. A long-term study following more than 3,000 older adults found that those with the highest cumulative use of strong anticholinergic medications had a significantly increased risk of developing dementia compared to non-users. This doesn't mean occasional use is dangerous. It means that chronic, long-term combined exposure deserves careful review. A medication checkup, sometimes called a medication reconciliation, can identify overlapping drugs with similar effects. Now, let's talk about protection. While reviewing medications is important, lifestyle also plays a powerful role in brain health. No single food can prevent dementia, but dietary patterns rich in certain nutrients are consistently associated with better cognitive aging. Final thoughts. Medications are tools. Many are essential, some are life-saving. But in older adults, the brain becomes more sensitive to chemical changes. What was once well tolerated at age 40 may affect cognition at age 75. If you or someone you love is experiencing new memory problems, confusion, or brain fog, consider these steps. Review every prescription and over-the-counter medication with your doctor or pharmacist on a regular basis. Even common cold remedies or sleep aids can have cognitive side effects, especially when combined with other drugs. Ask specifically about your total anticholinergic burden. Many medications share similar brain-blocking effects, and the combined impact can be stronger than any single drug alone. If concerns arise, discuss whether safer alternatives, lower doses, or non-drug approaches might be appropriate for your situation. Never stop a medication without medical guidance. At the same time, strengthen your brain from the inside out. Prioritize balanced nutrition, regular physical activity, good sleep, and control of blood pressure, blood sugar, and cholesterol. Protecting vascular health is one of the most effective ways to support long-term cognitive function. Knowledge isn't about fear. It's about protecting your brain one smart choice at a time.